Hello, everyone. My name is Agatha Morello, and I'm a postdoctoral resident at Nova Southeastern University's Mailman-Siegel Center, specifically the Developmental Assessment Clinic. Today, I'm going to talk about how to improve their snooze and talking about sleep concerns in children. So just an overview of what we're going to cover today. We're going to talk about why sleep is important. I'm going to go over the basics of sleep, discuss some of the sleep problems, and then how to help, right? So we're going to go over general sleep hygiene, problems with falling asleep, staying asleep, the parasomnias, and any other sleep concerns. So why is sleep important? So when we think about sleep, it's a healthy brain function and it leads to emotional well-being. So it's almost a refresh of the day where our body and our brain gets to rest, and it allows us to better concentrate on work the next day or on what we're doing the next day. It helps us with our mood. It helps us overall just be a better functioning individual the following morning. When we think about physical health, sleep is really important in keeping us healthy. In regulating as well as how often we're eating the following day, helping us in our growth and in our motor skills. So what are the basics of sleep? So what controls sleep? We're going to talk about sleep pressure, right? So the longer we're awake, the more likely we're going to fall asleep, right? So the more hours that we stay awake, we start feeling this pressure in our bodies to fall asleep. We also have our circadian clock, which is that internal clock that regulates our wake time and our sleep time. And this is affected by environmental cues, as well as melatonin. So our body produces melatonin, which regulates our ability to fall asleep and feel sleepiness. And then when we talk about environmental cues, we're talking about when the lights get dimmer, when the sun goes down, when it gets darker, we start to feel more tired and more sleepy. What are the stages of sleep? So briefly, I'm going to discuss the REM and the non-REM. So REM, this is our active sleep. This is where we're dreaming, our body is typically paralyzed, our muscles are relaxed, and this accounts for about maybe 25, a quarter of our sleep time. And then we have the non-REM sleep that's divided into these 4 stages that you see here that we go through. And here is where we end up seeing the difficulties in sleep, right? So difficulties to wake. How much sleep should children be getting? So when you look at this graph, you're going to see that as children get older, the sleeping during the day diminishes. And that happens around age 4, where they no longer need those daytime naps. And then what you're going to see is as they get older, you know, the amount of nighttime sleep, it about averages out. And we'll talk a little bit more in the following slide about what each age range specifically needs in terms of day and night sleep. So here, for newborns, so we're thinking about 0 to 2 months, they need about 11 to 18 hours of sleep in total, and this includes both day and nighttime. Infants as well, so this is from 2 to 12 months, they need about 12 to 13 hours of day and night sleep. When we're thinking about toddlers, and this is ages 1 to 3, they need about 11 to 14, so we're still needing plenty of sleep. And here at around 18 months, that's where we're eliminating that morning nap. And then you end up having just a long afternoon nap that can range anywhere from 1.5 hours to 3 hours. And then around ages 2 to 3, what we end up seeing is a lot of children switch from a crib to a bed. When they're in preschool between ages 3 and 5, they're still requiring a lot of hours of sleep per day, but at this point they've eliminated naps during the day. And here is where we typically start seeing night fears and nightmares. And I do want to note that night walking is common in toddlers and preschoolers at this age. So for school age, which is 6 to 12, they still need about 10 to 11 hours of sleep per day. And here's where we start seeing those parasomnias, the nighttime fears, the snoring, the noisy breathing. And what we're noticing, you won't see here about teenagers, but older children, it's actually, they still do require a lot of sleep during the day, and they often report feeling tired in the morning. So teenagers aren't morning individuals. So it's typical for them to feel more fatigue earlier in the day. So when children don't sleep, neither do you. So I find this comic funny, but also very realistic to what the relationship between your role as a parent and your child, what's that the sleep, how that impacts that relationship between the two of you, right? So if your child doesn't get enough sleep, they will probably be more whiny, more crying during the day, more difficult. We're going to see an increase in those negative behaviors, and that'll make you have perhaps less sleep that day and less ability to concentrate, focus, and go about your daily activities. So that's why it's really important to try to improve on those areas of sleep early on for your child. So what are these sleep problems? So about 25% of kids experience just some type of sleep problem in general. And almost 75% of parents want to change something about their child's sleep. So childhood sleep problems can be chronic, but they are treatable, and they're often even preventable as well. About 80% of kids, when we're thinking about sleep and issues in special populations, about 80%, up to 80% of kids with either intellectual or developmental disabilities, they're going to end up having sleep problems. So for instance, children with autism spectrum disorder, about 44 to 86% have sleep problems. This can include falling asleep and staying asleep. Maybe they'll have lengthy night walking, reduced REM duration, right? So remember, REM is that restorative sleep. So reduced total sleep time, right? So as you can see, this is all kind of a cycle that loops in to each other. So if you're having difficulties falling asleep and you're having also night waking as well, this is going to have reduced REM. You're going to feel more tired. You're going to see more of those maybe sensory behaviors, repetitive behaviors during the day because they're not fully rested. So again, what are the consequences of poor sleep? We're going to see, like I mentioned, that exacerbation of those features of autism spectrum. So more repetitive behaviors, a tougher time with those social skills and making friends, increased hyperactivity. They're going to be easily distracted, and we're going to see an increase in those challenging behaviors. Some other medical conditions that are known to disrupt sleep, gastrointestinal problems, right? So if we're having GI issues, it's harder for us during sleep to be able to get to that resting state. Individuals with ADHD, as we know, the medication that they take is correlated with issues of insomnia, and then anxiety as well, right? So the rumination, it has difficulty in falling asleep. So medications, already discussed ADHD, but certain medications can also get in the way of our ability to fall asleep, stay asleep, or wake up in the morning. And then genetic differences as well. Some of us are just going to be predisposed to having more sleep difficulties. So I bet at this point you're thinking, how can I help my child? What can I do? So we're going to transition now into talking about how we can help our children better sleep. So general tips, I want to talk about sleep hygiene and what does that look like. So we're talking about sleep hygiene. We're talking about the habits and the practices that promote sleeping well on a regular basis, right? And this is the key to achieving that full daytime alertness. When we think about sleep disturbance and daytime sleepiness, they really are the most telling signs of poor sleep hygiene, right? So a little bit more on sleep hygiene. You want to limit the physical activity during the hours before bedtime. What we want to do is when we think about those environmental cues, not only is the sun going down, but our body starts to slow down, right? So if we start getting into physical activity, working out right before bed or jumping around, it's going to be harder for our body and our brain to say, hey, it's time to go to bed. And when we think about caffeine, right, so we definitely want to eliminate caffeine, and this can be from sodas, from certain sweets, and even chocolate as well has caffeine. So when we think about drinking caffeine close to bedtime, it's going to be harder for us to fall asleep and be able to tell our body, you know, for our bodies to be able to recognize that we're tired. You also want to establish a bedtime routine, right? And you see in this example, and what you can use with younger children, even older children, is kind of having a chart as to what to expect during that time. So what are the steps for falling asleep, right? So here in this, for example, bedtime, we have wash. So we're going to take a shower, put on our pajamas, brush our teeth, drink some water, go potty, read some stories, kisses, and then lights out. That way, we start preparing our young children to establish a bedtime routine in order to help them get ready to go to sleep. And we also want to not only develop a regular bedtime, but also a wake time routine as well. When we think about sleep hygiene, we want to reduce the noise, the light, and the extreme temperatures in the bedroom, right? So when we're thinking again of those environmental cues, we don't want to have really bright lights in the room. That's not going to help us fall asleep easily, right? We want it to be a nice, quiet, dark place. And when we're thinking about extreme temperatures, we don't want it to be too hot where it's unbearable, right? And we also don't want it to be too cold or we're uncomfortable. We want to maintain a consistent sleep environment. So when we're looking at these images here, the one to the left is preferred, right? So at night, we'd be putting down those blinds, turning off the lights. And here it's not as preferred because as you can see, the curtains are open and it's really just shining into the bed. We also want to make sure to give a bath at least 2 hours before bed. And this is something that when you think about having multiple children, this might be a little bit more challenging to do, to make sure everyone gets a bath at least 2 hours before bed. But I encourage you all to set up a plan and a schedule. Maybe the younger children go first, the older children go afterwards, allowing that time for everyone in order to get bathed. Those that require more help, if you have a partner or another family member in the home, to work together with them to make up a plan. But we want to work towards setting a routine for bath. Okay, so this is a very popular question in terms of what do we do with electronics? So in the world of electronic age, where we have our children who have tablets, who have phones, we have the TV in our room, or even handheld devices such as like a Nintendo DS or whatnot, we want to make sure to dim the lights and turn off the electronics at least 1 hour before bed. And what the doctors are recommending is in order to tell our brains it's time to go to bed, a lot of times some of the lights that come from these devices are really sending messages through our eyes to our brain, letting us know, hey, we're still awake, right? So we're still working, we're still running. So if we do this if we turn off all these electronics 1 hour before bed, it gives us enough time to slow down the mind and get prepared for the state of sleep, rather than if I'm looking at my phone immediately before bed. And now I know there are certain applications where you can dim the lights or you can block certain lights. We recommend in general just at least 1 hour, just turning, just to dim all the lights, make it darker, just to start setting the environment for the bedtime. We only want to engage in sleep promoting activities in bed, right? So here, when we're thinking about what we want to do, so reading, a lot of times, reading right before going to bed, this can relax the mind and this can help ease us into that sleep stage. So this would be an appropriate activity to do before bed. Versus watching TV, again, that goes into the lights, right? So the lights of the TV are still signaling our brain that we're awake. And it's a lot harder to remove a fun TV show in order for a child to fall asleep. So we definitely want to make sure to turn off TVs. In terms of sensory, so when we're thinking about children on the spectrum, they are more aware of noises at night that don't bother other children, right? So even a TV in another room, water running. We want to make sure that there's really silence for this individual, and making sure that they have that calm, quiet environment. It also may be helpful to invest in some white noise machines. So I know they sell those, a sound machine. You can get air purifiers now that come with a noise. Sometimes even the sound of the ceiling fan. The fan, I know personally for me as a child, I waited for the air conditioning in the house to turn on, and it was like a yoink, and then you hear like a zooming sound as the air is blowing to help calm me down and block out all other noise. So other sensitivity issues may include problems with textures or bedding and pajamas, right? So you want to make sure to choose loose and light pajamas, right? Or light covers. We don't want anything that's going to be itchy or scratchy or too hot or too compressing for these individuals, or for anyone really. It's uncomfortable and it's not going to help us sleep. So co-sleeping. So this is something that a lot of individuals engage in, and a lot of people seem to be on the fence whether or not to co-sleep or not. And I do reserve the right to say whatever works best for your family, whatever is in line with your beliefs and your practices. I do know that some of the concerns that I've heard from parents are, or the concerns in terms of the literature are, if the child falls off the bed during sleep, or you have to be worried about not rolling over the child. A lot of parents have expressed concerns about lack of privacy and intimacy because of the child. So again, whatever works best for you all. If you find that co-sleeping helps your child, whenever you are ready to change from co-sleeping to having your child independently sleep, to seek outward help in order to help transition with that transition. So the benefits, of course, it's going to help your child fall asleep easier because they have you there right next to them to comfort them, and they feel safe and secure. But again, the risks are, maybe the child rolling off the bed, or maybe someone rolling onto the child in the middle of the sleep, having to worry about not doing that. So it's a give and take. One of the disclaimers as we're getting into these techniques is, before using any of the techniques, we hope that you check in with your pediatrician, right? So not everything is going to work for your child, and not everything is appropriate for your child. So you want to make sure that if your child is having sleep concerns, to check in with your pediatrician and let them know what technique you're thinking of, and if that works well for you and your child. So sleep problems. What are some of these sleep problems? They may include issues with falling asleep, staying asleep, right? There might be some odd behaviors that are associated with sleep. And then this could be waking as well, or daytime sleepiness. So these are some of the problems that we're seeing. What are the problems with falling asleep? So about 4 to 15% of kids take at least 1 hour to fall asleep. So here you can see where turning off electronics and setting the stage for sleep will be helpful, because some kids already have difficulties with falling asleep. So here's some methods that help with falling asleep, and I'll discuss them further. So we have bedtime fading, crying it out, the Ferber method, the excuse me drills, and the parental presence fading. So what is bedtime fading? So what you want to do is you want to set a bedtime for when the child is very tired, right? And again, you want to make it realistic. Sometimes maybe your child right now is falling asleep at 10 o'clock at night. That's fine. We want to use a time that we know that they're tired, because this will make the child more likely to fall asleep quickly. You can later adjust that time and slowly in increments push it forward. But for now, for this technique, you want to make sure to pick a time where you know the child is going to be exhausted. Once the child is falling asleep easily at the new bedtime, so for this one, you want to start pushing it up about 15 to 30 minutes. For about 2 to 3 days, and you want to move it up about 15 minutes earlier, right? So you're slowly moving it up until they fall asleep at the desired bedtime that you would like, right? So maybe that child starts at 10 o'clock, but you're hoping for them to get to 8 o'clock. So in a matter of a couple of days, you slowly start moving it 15 to 30 minutes up, putting them to bed, and then hopefully continue this process until they're able to fall asleep at the desired time, which in the example was 8 o'clock at night. The next method I'm going to talk about is the cry it out method. And this, I want to note, it's to try with children who are 6 months and older. So here, you know, this technique, there seems to be a divide as far as how people feel about this technique. Some parents that I've worked with feel like it might be cruel to have your child cry on their own and leave them crying. I think one of the concerns here is the safety of the child. So if there is a concern for safety, of course you want to go in and attend to the child. But the premise behind this method is basically your child has learned that when I cry, when I'm upset, I can't fall asleep. So I need to cry. My parents come, they soothe me, and then I can fall asleep. So it's almost this learning to help them soothe by themselves and fall asleep on their own and no longer rely on you as a parent to do so. So what you want to do is you want to put the child in bed at a designated time. And like the method says, you're going to let them cry it out and you're going to ignore the child's crying until the morning. And, you know, again, with this, you want to make sure to take data. You want to see that you're hopefully seeing that there's an improvement in about 3 days, right? If you really don't see any level of improvement and the child is still crying and protesting and having a really hard time with this technique, go ahead and, you know, you could try something else or consult and see if there's any other methods or see what's going on. So now discussing the Ferber method. So this is similar to crying it out, but you're spending an increasingly longer amounts of time ignoring, right? So here, what you're doing is let's say on Monday, you put the child down and they start crying. And maybe 2 minutes in is when you come into the room and you soothe them, right? And you say, oh, it's okay, go back to sleep. And then Tuesday, you push it to 5 minutes. Wednesday, you push it to 7 minutes. So here, it encourages them to fall asleep independently. And what you're hoping for is as you're pushing the time up and when you go and intervene, the child is able to fall asleep on their own before you get there. So this one might be another method perhaps for parents who have tried the cried out method or maybe feel uncomfortable with the cried out method, because this one you are coming in and you're just redirecting them to fall back asleep. So here you're not picking them up, you're not soothing, you know, it's just kind of, okay, I see you, you're okay, it's okay, go back to sleep, and then stepping back out. So here, the excuse me drills, all right? So step one, you want to put the parent, the parent puts the child in the bed, and the parent says, excuse me, I have to check on something, I'll be right back, and they step out of the room. And so basically the parental time out of the room, you're gradually extending it based on the child's tolerance. And the increases should always be brief to minimize the stress. And you always want to return, right? So it's, excuse me, I'll be right back. And then you come back. And basically, again, this is similar to the previous one, but instead this one, you're in the room with them. And instead of depending on you to fall asleep next to, like with you sitting next to them, you're giving them some time to try it out on their own. And you're slowly spacing out how much time you're giving them before you come back into the room. But you always want to make sure to come back as planned. So you want to, like I said, continue increasing the amount of time until it equals the amount of time it takes for the child to fall asleep. Okay, so if you know for your child it takes about an hour, maybe start with a small 5-minute increment, then change it. I'll be right back, come back in 5 minutes. The next day, I'll be right back, come back in 10 minutes, and so forth until you know that the child gets, until the amount of time it takes for the child to fall asleep. Once this happens, right, the parent will begin completing the bedtime routine and saying, good night, I'll see you tomorrow. All right? So once you reach the time it takes for your child to fall asleep, you want to say, good night, I'll see you tomorrow. And what you're doing here is you're combining the reinforcement program, like it's combining a way to motivate the child, right? So a reinforcement program that typically maximizes the child's motivation. So the next example of what you could do with children who have difficulties falling asleep is the parental presence fading, right? So you're going to start by sitting or lying next to them on the bed. You're going to then move to the foot of the bed, right? Move to the chair next to the bed, move to a chair closer to the door, move the chair next to the door, move the chair outside the door with the door slide. So you're slowly fading your presence away. you want verbal and physical comfort and attention should be minimized, right? So you're not there talking to them or petting them. Your presence is what's there, and you're just sitting there. And you're slowly fading away until they learn to fall asleep on their own. And then the bedtime pass. I really like this for older kids. I think a lot of times, and I remember doing this as a child, I really didn't want to go to sleep, and I would come up with every excuse in the book to get out of bed. So my mom already put me in bed, I was ready to go, and it's, I need to drink water, I need to go to the bathroom, oh, but one more hug, oh, but one more kiss. So here, to minimize that, right, because as we know, what's one hug, we start saying yes, but then it becomes about like what could have been a 1 hour process to fall asleep has now become a 2 hour of getting back up and going back to bed. So what we want to do is we want to eliminate that by giving them this bedtime pass. And basically what the pass is, it's good for just one kiss, hug, drink or water, or quick check of my room, or an extra tuck-in, right? And the child, what you're letting them know is you are allowed to exchange this pass for one easily satisfied request. And when we're talking about easily satisfied requests, these are things that are quick, that can be done, and they could still go back to sleep, right? So a kiss, hug, water, the request shouldn't be, let me watch one more episode of this show, or let's play Monopoly. We want something to be a quick amount of time, something that they can easily do, and then go back to going to sleep or going back to their bed. And this is something that they're only allowed one in the evening. So moving on sleep problems, we also have problems staying asleep. And this is actually a very common problem faced by parents, especially with infants and toddlers. And then if you look at the comic here, the man says, he's finally asleep. I'll just give him a little goodnight smooch. And the woman says, if you wake him, I'll rip your face off. And as you can see, the frustration here that the parent is facing is, it took forever for this child to fall asleep, and they're finally asleep. Let's leave them staying asleep. So the difficulty in reinitiating sleep, what ends up happening is they're waking about 4 to 6 times per night. And this is within 30 to 40% of kids, they can't reinitiate sleep on their own. So now we have kids waking up in the middle of the night who are seeking out parents to help them fall back asleep because they can't do it on their own. So how do we help improve their snooze in terms of staying asleep, right? So getting out of bed, this is the robotic return. You want to guide them back to the bed with zero attention, right? You want to just redirect them right back to bed and say, okay, let's go, in order to help shift them back. So what are some other sleep problems? So we have parasomnias, right? And what are parasomnias? These are behaviors that occur when the child is in a mixed stage of being both awake and asleep. And this can include sleepwalking, sleep talking, and night terrors. So why do they occur? What are some of the reasons? So sometimes they're just not getting enough sleep, or their sleep is irregular. Genetically, they might be more predisposed to having one of these parasomnias. The medications, some of the side effects of the medications that they're taking include these issues. Maybe they have an illness that's complicating and having these occurrences. A new or a different sleep environment sometimes can cause these. Stress, for sure. Or sleeping with a full bladder, which is why we always recommend going to the bathroom before going to sleep, so that you can have that feeling of having an empty bladder helps them further relax and enter the sleep state. So what is sleepwalking? The child appears confused, dazed, or agitated. They're clumsy, and there's some bizarre actions. And then when they wake up, there's really no memory of the event. And then just for some statistics here, so almost 40% of kids sleepwalk. And this is the highest is between ages 3 and 7. And it's about 33% for 5 years, and then 12% for 10 years. So we're seeing a majority, we're seeing higher amounts of time that this lasts. This occurs within 1 to 2 hours of falling asleep, and it lasts for about 5 to 20 minutes. And okay, so now on night terrors. So what are night terrors? They're sudden arousal from slow wave sleep. And this is typically accompanied by screams. And they also don't have any memory of this event. This happens in about 1 to 3% of children. It occurs within 1 to 2 hours of falling asleep, and it lasts anywhere from a few minutes to an hour. And this can be very distressing for children, especially if they're waking up yelling and they don't understand what happened, or what they don't recall what happened. So parasomnias, how to help, right? So what is your role in terms of your response? So we want to keep them safe, guide them back to bed. We don't want to really interfere with their sleep, especially if they're sleepwalking. We don't want to interfere. We don't discuss the next day. We want to maintain that sleep schedule that we discussed in the beginning, in order to ensure that they have enough sleep, and we don't want to wake them up. So even though we see them engaging these, we don't want to interrupt. So we have scheduled waking. So what you want to do is you want to take note of when this parasomnia event occurs. We want to wake the child 15 to 60 minutes before it occurs. So it's almost like controlling the behavior before it happens. And then we want to continue each night for 1 week, discontinue for 1 night, and then that should alter the sleep pattern in your child. So this is the scheduled waking approach. When should you consult your doctor, right? So if your child is having any problems with breathing, you definitely want to consult. Any excessive movement while sleeping, right? Because when we're thinking about sleep, our body is paralyzed, right? We release the melatonin that helps us relax. We enter that relaxed state, and our body should not be moving too much. Excessive sweating, confusion or expression of terror, and then parasomnias as well. Some of the parasomnias, if you see that they're not going away, you want to be able to consult. So I'm going to open it. Well, this is a time for if anybody has any questions. So I'm going to talk a little bit about what common questions we usually get in terms of sleep. I think a lot of parents struggle with their role and knowing when to involve pediatricians. And I think always from the get-go, you want to double check that whatever intervention you're doing is working, especially if you're trying to change the behavior, but you're unfamiliar with what parasomnia or what sleep concern your child has. You definitely want to start monitoring your child's sleep more often if you think that there's a concern. And even now, during the time of coronavirus and the quarantine, this is excess stress for everyone. And what we're going to see with stress and changes in routine is some children might respond by having more difficulties with sleep, whether it's falling asleep, staying asleep, and so forth. So we definitely want to be wary of that. Also, what you want to consider when discussing what methods you want to do with your partner is really making sure to find the one that fits best for your family and one that you're comfortable with. So again, going back to the cry it out method, the Ferber method, you want to make sure it's something that everyone's on board with and something that you can implement. I think one of the things with any of these interventions in terms of behavioral is you want to make sure to commit to it fully, because I can see how those techniques can make it difficult, make the sleep problem even more difficult if you don't follow through. So for example, for the cry it out method, let's say a new parent tries it out the first night and starts letting the kid cry it out. And maybe 2 hours into the crying, the parent can no longer take it, comes in, picks up the kid, holds the kid, oh my God, I'm so sorry I did this to you. So what did the kid just learn? If I cry it out sufficiently, I will get some attention, I will get soothed, I will get affection, I will be able to fall asleep. So we want to make sure, what's happening is the next time the parent tries the cry it out method, it's going to take even longer and it's going to be even more difficult for the child to soothe. So with any of these interventions, you want to make sure to commit fully when you're trying them out. I even think of the bedtime pass. you want to make sure to just stick to one, just one. And I think it's hard because when you're first trying these out and kids might be over eager, they might choose something that they, something like a hug or a kiss, but then really in fact need to use the restroom. And then it's picking and choosing, okay, well, I already gave you the pass for the hug, but now you have to use the restroom. In that sense, we want to make sure to be flexible with them, have them use the restroom. But that's why the sleep routine is very important, to include potty time in order for that to not be an issue, right? And to not drink water in between the potty time and the in the time that they fall asleep. Here's some helpful resources for you all. We have a couple books. So here is Good Night, Sweet Dreams, I Love You. Now get back to bed and go to sleep. So this is how tired parents can solve their children's bedtime problems, written by Patrick Freeman. And then the next book is Sleeping Through the Night. This is by Jody Mindell. And this is for help for how infants, toddlers, and their parents can get a good night's rest. And again, these books are not only to help inform parents of techniques and the difficulties that come along with sleep problems in these age ranges, but also to support and to normalize the process. Because you're not alone, as you can see from the data. A lot of parents have difficulties in terms of getting their child to either fall asleep, stay asleep, or wake in the morning. Okay, this is our references. All right. So I just want to say thank you so much to everyone who watched this video. I hope it was helpful for you all to have some techniques in order to better help your families. Appreciate you all. Goodbye.